Was my cue. So I'll go ahead and get started. Welcome to all of our TLC sites. We know it's been a long couple of months, and we're coming down to the last couple of months, and we're very excited you were able to join us today for today's collective TA session. Going to just be brief and thanking you all for continued working with the coaches and the coaches team. We look forward to learning more and more from you each day to help the broader field. And we look forward to a good meeting today. With that, I will actually turn it over to Jeanette to get us kicked off. Jeanette.
Yeah, hi. Well, welcome everyone. I'm so happy you could join us. And as Damon said, it's been a journey. So it's really exciting to have you all here. Today's collective TA event for Laser TLC is really going to be focusing on adapting outcomes and identifying new metrics for success. And it really builds on the work that we have been doing here with Laser TLC for the last several months. And particularly in June, we began by exploring strategies that really would help sites think about how to shift organizational culture and align mindsets and skill sets with your change agendas. And then most recently in August, we focused a lot on coaching. And what does it really look like, the different approaches to coaching and coaching models, and the importance of case management strategies and staff training on really program impact. So today we're building on those particularly those last two sessions, and we will hear from a couple national speakers at the get-go, and they're going to share various examples about how states and counties have approached and implemented different metrics, establishing metrics, and how they have looked at focusing on outcomes for TANF recipients and TANF families. That will be followed by two practice models. I'm very pleased to say we have both someone from California Department of Social Services, the CalWorks model, to share their framework for what they've done to establish benchmarks, as well as Hennepin County, two representatives from Hennepin County from Minnesota, to talk through why they approached the procurement process the way they did and how they really focused in on what TANF program performance would look like. We always, our principles, we want to stay true to our principles. One thing that team leaders here at Laser TLC have always reiterated was they really want time to ask questions of people. They want real practice models, and they want to have an opportunity to hear from their peers and talk to their peers in dialogue. So after these presentations, we're going to spend about 30-40 minutes into breakout sessions that will be facilitated, and people will be just randomly assigned to one of the two breakout rooms, and then about 15 minutes in, we will switch out the speakers and the facilitators of those breakouts so that everyone, all the participants, will have an opportunity to ask questions from the whole array of our presenters today. So that's what we're going to be doing, and I hope that feel free to ask questions, put items in the chat box. We're kind of doing presentations up front and leaving that Q&A for the breakouts, but if you feel pressed, please put something in the chat box, and we can try to respond as quickly as possible. So without further ado, let me introduce our two first speakers. We're going to first hear from Mary Nelson. She's a policy associate at the American Public Human Services Association. She's going to talk through a little bit about the APHSA's approach to TANF modernization, particularly looking at how different TANF programs across the country, what they've considered as they began to establish and think through establishing both short and long-term outcomes for what some of those success metrics look like for TANF programs. That will be about a 10-minute presentation. And that's going to be followed by two individuals from Third Sector Capital Partners, and Jess Crackpath, Managing Director for Economic Mobility, and Joanna Joanna Williams, who is the Manager of Federal Business Development at Third Sector. we'll be talking through what third sector has worked on and highlighting actually some work that they've done with the state of Massachusetts. I know for our laser TLC sites, a couple sessions ago, maybe in May, we actually had DTA from Massachusetts in and present. So without anything taking any more time here, I'd like to turn this over to Mary Nelson for her presentation.
Hi, everyone. Thanks so much for having me. As Jeanette said, I'm Mary Nelson. I am the Assistant Director of Practice and also the Staff Liaison to the National Association of State TANF Administrators. I'm going to try and keep this short and sweet and just do a little bit of level setting of what we're hearing around how state TANF administrators and their staff are approaching outcomes and use of data and evidence within their TANF programs. So first of all, I just wanted to kind of ground this in some of our TANF modernization work. And we have had a group of TANF administrators as well as their staff participate in coming up with a set of core principles that should be included in any TANF, any modern TANF program, and just flagging that core principle 4, and there is a link here which you all will receive the slides afterwards, I believe, so you can explore all the links that are in this presentation, but just flagging that core principle 4 here really emphasizes that to best help families achieve their goals, TANF policies should be centered in evidence and promising practices, and that should also reflect the lived experience of the families that are being served. So we know that understanding outcomes, understanding how we can really evaluate programs to make sure that they are successful in supporting our families in their social, emotional, and economic well-being is top of mind for you all and for others who are working in the field. So what does that really mean? Some common strategies that we really are hearing from our members, state and local TANF administrators and their staff, are really thinking about using both data that you already have. So you have an immense amount of data that's collected already because of your reporting requirements to the federal government, or perhaps you have reporting requirements to the state. So really looking to how can you combine that data to really understand what the families that are utilizing your programs look like and what their needs are, and then how they are progressing as they move through supports and services that you're offering. And then you can also think about collecting new information. So I think that these two sides of the coin speak really well to the bullets that are below. So thinking about the data that you already have, you might also be thinking about aligning and building on WIOA performance measures, so data that's being collected by your state Department of Labor, and thinking about how that plays into combined state plans. And I'll share an example of that in just a minute. But you also might be thinking about assessing for social determinants of health. So you might be thinking you would want to know not only about employment and education outcomes, but also what does social and emotional well-being look like for families who are receiving TANF cash assistance or participating in the supports and services that are funded through TANF. And I'll give some examples of how states are really looking at social determinants of health to understand their TANF populations and how to really integrate that into the programs. And then you might finally also just think about utilizing traditional evaluation of programs and services to really look at explicit providers or programs that they're utilizing. Maybe you want to understand, how does family-centered coaching impact service delivery and outcomes for families? Then you might just look to kind of traditional program evaluation strategies to understand for that explicit program or that explicit service, how successful is it in achieving the outcomes that you're looking for. And you might think about within that how you can embed those outcome measures and evaluations into your contracts. And I know that many of the bullets that I'm speaking to right now are bullets that the speakers that are coming after me will also be able to speak to. So I'm trying to keep it kind of high level and not going to go too much into detail here. So the first example I have is the Colorado Works Leavers Survey. So this is a survey that is given to a sample of Colorado Works participant, which is the Colorado TANF program, who have recently left the program. And it's really intended to understand the experience of the that individuals have had in the program, their beliefs about the goals of the program, perceptions on how they contributed to their family's goals and success, reasons for leaving, and then also some assessment of their current employment status and wage rates. So one thing that I think is really interesting, and you can, I don't think I'm sharing my full screen, so you won't see it if I click on this, but when you receive the PowerPoint, you can click on the link here to look through the explanation of how the survey is administered, but also you can look at the most recent publicly available summaries from the survey, and they're really able to extrapolate some key themes around at least the participants who participated in the survey, their experience with TANF cash assistance, as well as the supports and services that are being offered, and really draw some observations about access to housing and childcare, just as an example, and start to understand what are the impacts of those supportive services, or really looking to some aspects of social determinants of health, those impacts also tying back to employment and education outcomes. So for example, if you look at the summary on housing, you'll see that they were able to, at least from the population who participated in the survey, understand that those individuals who did not receive housing services were also tended to be more likely to experience criminal activity or to recidivate if they were returning citizens. And that's not to say that there is explicitly a correlation there, but that's something worth exploring more to see, well, can we really bolster our family's success if we are able to provide housing opportunities, partner with our other key programs? And so the survey is really serves as an opportunity to make continuous improvements and look at where investments can really support families, both in looking at their social and emotional well-being, but also some aspects of employment and economic outcomes as well. So the next example that I have here is from Indiana, the Hoosier Health and Wellbeing Atlas. I included links to both the Health and Wellbeing Atlas as well as the Equity Portal for Social Services. They are the same data sets. And one thing I want to share too is just because what you're seeing is what's publicly available doesn't mean on the back end that they have access to a lot more information that they can coordinate and organize in different ways. So for this particular survey, what you're seeing from the public dashboard are the results of participants who took the survey at the application point for both SNAP, TANF, and I believe Medicaid is included as well. So us as the public viewers of the information aren't able to drill down programmatically, but my understanding is that they can on the back end and do look at what this data looks like programmatically. So this survey is really administered in order to better understand how social determinants of health are impacting communities. There are 10 questions, and I have the questions here just to give you a sense. And you can take a look at the actual dashboards later and explore more fully. But looking at families not having enough food in the last 12 months, utilities being shut off in the last 12 months, fear of not having stable housing in the next 2 months, problems with getting childcare, costs prevent the family from seeing a doctor in the last 12 months. Transportation prevents the family from seeing a doctor in the last 12 months. Needing help reading hospital materials, fear of being hurt at home, and actively seeking work in the last 4 weeks, and then not engaging in regular exercise. So getting a sense of, at the family's entry point, where are they struggling? Where are their challenges? Where might they not need as much support? And this data is able to be broken down by county and is also disaggregated by race. So there is also a little bit of an ability to start getting a sense of where there might be disproportionalities. There are limitations of the survey that the population that's being surveyed is only those who are applying for assistance. And so you have to also look at disproportionalities within the responses compared to the rate of the survey respondents. So just because you see, a high response rate of individuals who are African American saying that they don't have enough food, for example, in the last 12 months, you would also want to look at the number of respondents within the total pool who were African American. So I want to shift to another example that I think is a really good example of seeing where you can start to align with WIOA and WIOA performance measures. And I just want to say too that these are just 3 examples of what we're seeing and hearing in the field. These are not the only examples, and certainly there might be others that show innovations and other approaches, and including the speakers that you'll hear today. But just to give you kind of a flavor of some of the different ways you can approach looking at outcomes. So there are 2 things I want to flag as it relates to the Maryland Department of Human Services. The first is how they have really approached aligning workforce, and they have these broken down information sheets by counties and cities that really show some characteristics and outcomes for the Temporary Cash Assistance Program, which is Maryland's TANF program, how that breaks down for individuals who are receiving TCA and are also participating in WIOA programs. So they're able to see some economic markers, including employment rates and the median income a year before the individual was receiving TCA and then a year after exit. So looking a little bit at where there are fluctuations in work and fluctuations in the amount of income that's received. They're looking at the education levels of these individuals, also trying to understand too some sense of long-term disability and what does the population look like when they're experiencing long-term disability, and then really being able to see, well, what are the characteristics of the individuals that are receiving TCA who are also participating in these services. But also one of the things that I think is kind of cool about this is part of the intent in producing these information sheets was to be able to show that there are quite a few shared customers. And if they can start to really drill down on what those shared customers look like, the Department of Labor and the Department of Human Services could start to coordinate on how they would measure outcomes, how they would approach service delivery in ways that would be the most beneficial for these families. And that's really what this second link here, which is a snapshot of Maryland's TANF and WIOA alignment process, really walks through not only where these information sheets came from, but also how they plan to approach sharing of information, sharing of strategy and alignment of goals to best support these families. Yeah. And then
So Mary, we're going to move to third sector. Can you?
I have like 2. Okay.
2 seconds. Okay, go ahead.
Yeah. I just want to flag the last part of this as really just flagging where you can leverage research institutions to support the work that you're doing. So just showing how Maryland School of Social Work has supported the work that Maryland has done. And this last slide is really just a set of resources for you all to take away that have some considerations in how you might approach looking at outcomes. That's it.
Thanks, Mary. Appreciate it. And you please, all the laser teams, all of this information will be shared, all the slides will be distributed, so all those resources would be available. But please keep a list going for any questions you have with Mary and anything you want her to go deeper with the Q&A. With that, I'm going to turn this over to Jess and Joanna from Third Sector to really talk about particularly how to really align outcomes through procurement processes. I know that that is something that many of you are thinking about and interested in. So Jess, I think I'm gonna bounce this over to you.
Thank you, Jeanette. Good afternoon, everyone. Happy to be here with you all. Joanna's going to share screen. I'm Jess Prapath, Managing Director that co-leads our economic mobility practice area at Third Sector, and I also lead our anti-racist work. That's both what does it look like for Third Sector to be an anti-racist organization in our culture, our policies, our practices, and how do we support our clients in doing this, our government clients. Some of you might be familiar with Third Sector. Some of you might be new to us. We are a nonprofit organization. We provide technical assistance to help government agencies reshape their programs, systems, and services toward better outcomes for everyone that we serve. We've worked with many states, many state agencies and local government agencies across the country to support them in transforming their procurement processes and contracts to focus on outcomes. And most recently, I supported the Washington State Department of Children, Youth, and Families to implement outcomes-focused performance-based contracts agency-wide. We're excited to be in community with you all and excited to share more just about the procurement process at a high level and also dive a bit deeper into some of the work that we've done with Massachusetts DTA. Joanna, you want to introduce yourself?
Yeah, thanks, Jess. I'm Joanna Williams. I'm the Federal Business Development Manager here at Third Sector, where I help drive forward our business development work overall. Currently, I'm based out of Chicago, Illinois, and I'm just excited to be in the room with you all today, the virtual room, and talk to you about some exciting stuff that's going on. So the first thing we want to talk about is why procurement is a good opportunity to align on outcomes. And it is due to several reasons. For one, it requires agencies to begin aligning goals to results rather than the other way around. It also allows for agencies to consider system change with a provider when it's possible. And it allows for how past goals might have fallen short in past procurements. And lastly, it allows for continuous improvement. You're explicitly talking about the who's and what's a process for tracking progress and end goals and opportunities to improve outcomes in the future. In the end, most outcomes-focused procurements can lead to outcomes-focused contracting, which we'll get into more detail in just a moment. But I want to share just a quick outline of what outcomes orientation could look like during the contracting process. As you can see, once you're done with scoping and procurement, management is another important component and requires data sharing, reporting, monitoring with stakeholders in addition to the service delivery aspect. The last step, reflection, is a really key piece, especially during the contract renewal and procurement process, because this is where, those decision makings and that reflection piece all comes together to figure out how we're going to move forward the next time in a better fashion. Now, there are several components to going into developing procurements and outcomes-focused contracting, which are outlined here. When developing procurements, one of the most important pieces is thinking through each component. Very rarely the end contract itself. Procurements are a good space to plan for and begin executing on each component. For example, stakeholder engagement. Identifying who should be part of the process of developing the procurement, who will be impacted and that does have a voice, that does not have a voice, and when and how should they be brought in. At Third Sector, we believe that when service providers and clients come together is what is truly valuable. The procurement planning process allows for this to happen because you're coming together to articulate shared goals, create a process for tracking progress, start to discuss continuous improvement practices. So when you end with a procurement and then an outcomes-focused contract that can be used for accountability and reinforcement and should be looked at regularly and updated if needed. Now, we do have a poll. And I am going to pull that up. Just give me one moment to make that happen.
So Joanne, I have the poll and I'm ready to launch it.
Okay, okay. Thank you so much, Casey. If you don't mind watching the first poll question.
Okay.
Thank you. So the first poll question is, do you use or have you used procurements and contracts to align outcomes with providers? Yes, no, or I don't know. We're going to give you just about 15 to 20 seconds to answer that question. Okay. Casey, do you mind showing the poll results? Thank you. So it looks like almost like, well, close to half just aren't sure, which is a good place because I feel like this presentation is going to help you get a better sense on how to do that. But we do have more than, a third of folks who have said yes, which is also exciting to see. So I'm going to now turn it over to Jess to start to talk about Massachusetts DTA and the challenges that they were experiencing with their work. Jess.
Thanks, Joanna. And Jeanette, feel free to ping me if I'm running over time. I'll try to go through these slides fairly quickly as well. So I'll share an example of the work that we did with Massachusetts DTA. And I know Jeanette mentioned that they spoke with this learning community a few months ago. So excited to highlight more of the work that they did around procurements and to answer any questions you all might have in the breakout rooms. A couple of context slides for Massachusetts DTA and where the agency was when they approached re-procurement. So they learned from their data that 45% of adults who received economic assistance under the TANF program had grown up in families that also received TANF assistance. So really, they were looking for ways to break intergenerational poverty. And one of the ways that they intervened was using an upcoming planned re-procurement that they had to refresh on program expectations and outcomes and to learn about and take action to adapt the system in support of improved family outcomes. Joanna, if you can go to the next slide. We know that procurements and outcomes contracts are not a silver bullet. We know that oftentimes they're just one agency activity. Oh, if you can go to the last slide, Joanna.
Yeah, my computer seems a little stuck. Sorry. Okay, here we go.
Thank you. So we know that oftentimes the contracting piece and the re-procurement piece is just one agency activity that exists among many other critical components of a well-functioning economic mobility system. And DTA viewed their outcomes contracts as one place to untangle how they currently provide services to improve family outcomes. What was happening around the agency were also some broader discussions around policy reforms, a broader shift in agency understanding about why client engagement was important and how to start putting that into practice. And there was an interest in connecting to the existing workforce system. And outside of the DTA system, as we all deal with on a day-to-day basis, are all these other external factors that impact family economic mobility in a very real way, like labor market demands and rising housing costs. And as we share more about DTA's work, just want you all to think about, as you think about potentially putting outcomes-focused procurements and contracts in place in your agency where you don't have it already, or where you might already have it, what do you all think needs to be in place for your agency to do that? And feel free to drop in ideas into the chat or save them for the breakout rooms. Can you go to the next slide, Joanna? Thank you. So I mentioned that DTA had re-procurements already planned. They met the moment by realigning priorities with two programs, their Young Parent Program, YPP, which serves pregnant or parenting young adults, and their SEAS program, which supports individuals accessing TANF with training and job placement. I'm going to talk only about YPP today because of the short time. Next slide, Joanna. So in planning for DTA's upcoming re-procurements, they identified 3 goals that they wanted to make real in this process. Some of this they've been working with providers on for a while, but wanted to make explicit these sort of assumptions or the invisible things. And some of this they saw some providers doing, but not others, so they wanted to standardize expectations. And as I go through DTA's goals, if you decide to use reprocurements to reorient providers to something or to go deeper on something with them on, what would that be around? Again, feel free to drop your ideas into the chat or save for the breakout rooms. So DTA, as I mentioned, had 3 goals. One was that they wanted to provide individualized client-centered services. And they did this by, for example, promoting a 2-gen approach that looks at whole family well-being and not just outcomes for the adult, which is what they were doing before. DTA also wanted to pay for outcomes achievement, which was a new model for them. They knew that they wanted to maintain high expectations, but give flexibility to both providers and participants on how those outcomes would be achieved. And then finally, as I mentioned, DTA wanted to link more into the workforce system by connecting their education and training opportunities to the labor market rather than having them be 2 siloed things. Next slide, Joanna. So what did this work actually look like in practice to make the goals real? Third sector supported DTA on a number of different activities that really break down into 2 phases. The first phase was preparing for reprocurement with a heavy focus on stakeholder engagement. So third sector facilitated engagement workshops with a lot of different agency staff who touched the program in some way. So from the commissioner to the employment services leadership, to program managers, to finance, and they gave input on goals, outcome metrics of the YPP and the SEAS program. They really thought about, if we want to implement a 2-gen lens, what does that actually look like for both of these programs? And because they were reprocurements, DTA was also able to get provider input that third sector helped incorporate before the final solicitation was released. The second phase of work was supporting DTA to manage this newly developed outcomes-focused contract, which included staff training. So as Joanna mentioned, the outcomes-focused contract itself isn't the thing. The real work where we find is in helping it grow roots and really start to change and influence practice. Third sector started with contract managers, so trying to understand their job description, their mindset, what their approach was to working with providers, tools that they use, different pain points that they experienced. And one of the big things that we uncovered was that some contract managers were taking more of a technical assistance partnership mindset when supporting providers to achieve their goals, and others were taking more of a compliance-oriented approach. And DTA wanted to retrain and equip all of their contract managers to really take this sort of technical assistance partnership mindset and less focus on compliance. And it was great to have examples of what was already being done in the agency to hold those up and say, look at what your peers are doing, learn from each other about how you all are already doing this, and building off of some existing tools that they use to really standardize a toolkit for all contract managers to use. DTA.
Yes.
Yes.
Can you stay just really very extremely high level because we're over by 5 minutes already.
Oh, got it, Jeanette. Thank you.
Thank you.
So I'll actually take us over to the next slide. I have just a couple, and I'll speak to these super quickly. What we saw were 2 things. One was a shift in DTA prescribing a program model to focusing on outcomes, which gave providers flexibility to do what they needed to do to consider whole family needs. And the second was shifting from a focus on reporting to tracking measurable 2-gen outcomes and having meaningful discussions about how to improve on those outcomes. If you can go to the next slide, Joanna. Here's just really quickly the different outcome metrics that DTA chose, both that they tied payments to, and also ones that they committed to tracking progress on for continuous improvement in learning. And then I'll end on this next slide, which is just noting that we talked about culture change and sort of mindset shifts. One of the other things that DTA really wanted to make real in this reprocurement process was that the agency was taking on a broader initiative to shift the burden back onto the system, shifting the burden of navigating services off of families and back onto the system. And so the way that this culture change and mindset shift really looked was better coordinating the DTA staff, providers, and local offices around how people access services, how services were provided, and how data was used across the system to improve family outcomes. Sorry for going over. Happy to answer any questions.
This always happens. This happens all the time. I think, oh, it's only going to be 5-minute conversation. Thank you. Thank you both very much. I want to move very quickly into what we're calling our featuring of our practice models. We're first going to hear from Shannon Rohal, She is a Program Innovation Section Chief at CalWorks in the California Department of Social Services, and she's going to talk specifically about the CalOR Conceptual Framework and the approach from California. So Shannon, with that, I'll ask you, I know we're running a little tight and we want to make sure we have time for those Q&As. So if you could stay to 10 to 12 minutes, that would be great.
I will do my very best. Excuse me, let me pull up the slides, which I think are right there. All right, so we'll try and skim through this fairly quickly. Thank you all for having me. Back to the right slide deck. Excuse me, as Jeanette shared, I am speaking to you from the California Department of Social Services. And if it's all right with you guys, I think we're going to kind of wing it a little bit and we're going to skip through the agenda and you guys are just going to experience this with me together. So CalOR stands for the CalWorks Outcomes and Accountability Review. We really have a couple of goals and objectives. Our goal here is to create a local data-driven program management system that facilitates continuous quality improvement of all county CalWorks programs by analyzing, disseminating outcomes and best practices. And ultimately, the goal of CalOR is to achieve optimal program outcomes, as you might imagine, in consideration to organizational and like worker needs, critically to achieve optimal client outcomes. And we're talking about things that are kind of measurable and then trended out over time, right? So increase in wage progression, increase in earnings, decrease in program reentries, those kind of things as the outcomes that we're talking about. And then also to identify and change regulatory and statutory portions of the program that are not in alignment with the outcomes above. So that is what CalOR is. To give you guys a little bit of a framework, California operates a state oversight county administered program. And so some of the things that I say here are not necessarily going to land if you're a lucky duck and you have a program that is exclusively state administered, state overseen. There's pros and cons, and I'll talk about that. So this right here is the conceptual framework. It looks very intimidating, and I'm happy to take and drop a, I think Jeanette, I may have shared this with you, so if it's possible to share this with folks, that would be beneficial. But as you're thinking about possibly doing something similar to this, really kind of building out an outcomes-based framework for CalWorks, really the time spent in developing this is really worth your time and energy. And shout out to Melissa Kenny, who is on here, because I think that she helped to build this out a little bit. So she's a resource for you guys as well. We used to work together. So what we have here is a kind of progressive layout of what our CalWorks program is, what our TANF program is, within consideration to what our inputs are, our activities are, our outputs are, and then ultimately our outcomes. And when you understand the component parts that go into this, it makes it much easier to conceive of what kind of performance measures you might develop in order to track that progress and really maintain and implement and advise counties or your program on how to optimally achieve a CQI system, right? So these go in tandem. This is one side of what is the larger CQI system. This is the data side with which to use data-informed decision-making. I'm not going to spend a lot of time talking about this because I think that this is one of those things that you kind of look at, periodically for 3 to 5 minutes. You're like, oh, that's interesting. And then you dive back into it for a little bit longer and a little bit longer. Not a whole lot of value in going into it in an intense amount of effort. The planning process is really where this brings the most value. And I don't have a lot of time. So the CalOR components that we have, as I mentioned, two sides of the same coin. We have a continuous quality improvement cycle. It's a 5-year cycle. And then met with that are the performance measures. We really, in our perspective, can't really have one without the other. Performance measures are only so good as so far as you actually make action of them, right? Data for data's sake, not terrifically useful. And then your CQI system really does need to have some sort of data integration in order to be maximally effective. We utilize a series of reports, but we make sure to hyper-emphasize the fact that the reports are really just the byproduct of the analysis. And so the goal of CalOR is not to submit reports, it's to go through the analytical process and then document. So these are the reports that we have. Our Cal CSA, which is the county self-assessment, right? So your kind of planning section of your PDSA cycle. Our Cal SIP, which is our do and study section. And then our action part, ideally, which is our progress reports, unless, of course, fingers crossed it doesn't happen, but unless, of course, we end up finding that that's actually not yielding the optimal results, in which case we do it all over again and we try better next time. And so this is the part that I wanted to take more time to talk about. And Jeanette, how much time do I have?
Janet, you're muted.
Sorry, I'm thinking about kind of reformatting the breakouts very quickly right here with Casey Gray. So Shannon, why don't you take like at least maybe 4 more minutes?
Okay, I can do that. So these are what we call our CalR performance measures. We do have links in here that may be useful, but I'm going to speak about that actually at our in hindsight slide. So this is how we went through and we kind of built things out. We wanted to make sure that the performance measures were built from the perspective of accountability versus program management. And what we mean by that is outcomes-driven performance measures, the things that I talked about previously, wage progression, post-CalWorks, employment rate, those kind of things. Those are your outcomes. And then process measures, because you lose people when you focus exclusively on outcomes, because outcomes are less immediately impactable. I think that's a word. Whereas process measures tend to be those things that you can immediately see a change on when you make the change and then you track the data over time. But those ultimately are going to inform your outcomes. So those are a combination of the measures that we ended up applying. And predominantly we have process-oriented measures. Measures need to be prioritized. They should be connected to the design, right? So the conceptual framework, data sources, and use. Really think about what data sources you're going to be using. And then they should be focused on the outcomes of the program's affects. So going again back to that conceptual framework. And then of course, balanced and comprehensive. You want to have a full circle of understanding of the program in order to build out those performance measures. I have got other slides in here. If you guys are all right, I'm going to skip this one because I really want to go to the hindsight slide, because this is something that I think is really valuable, but things to consider when you're building out performance measures. Also really valuable as you're thinking about and building out that conceptual framework, bucketing things into themes. It makes it a lot easier and a lot less overwhelming for your partners as you're taking and developing these performance measures over time, making sure that you're understanding and having that balance of different categories that make up the entirety of your program. So right here is a beautiful graphic that I'm not going to spend time going over, but this is how we bucketed our performance measures, and I'll drop a link into the chat after the presentation that connects you to the explanation for all of these performance measures. We have 26 in all. And understanding your data flow, right? So this is just a graphic that shows these are all of our external data sources. They come into CDSS. And then we also have an other side of it, which may not be applicable to you if you are exclusively a state-run TANF program, where we get data influxing in from our counties through our consortia system and then into CDSS, which ultimately in the bottom, let me see if my cursor's there, the bottom bucket here is how we calculate the performance measures. And then we send it out to our counties for their review and post it onto our public dashboard. In hindsight, okay, so these are the things that we've learned. We've been running this since 2019, had a little bump in the road in 2020. You guys might remember that year. But otherwise, we've been running strong since 2021, relaunching. My recommendations are, if you're going to have if you're going to build this data infrastructure, keep that phased in approach. So we did 3 different phases. We have a phase 0, which is like the data that we already had available. We had a phase 1, data that wasn't too difficult to get to. And then phase 2, it required brand new programming, brand new training and stuff like that. Keep the phased in process, but try to stick with 2 to 4 measures at a time. It is very, very challenging to take a big block of performance measures with various different data sources and really spend the time going through and validating the accuracy and validity of that. It's very, very confusing. So my recommendation, stick to 2 to 4 measures at a time, get those squared away with confidence, sign it off, and then establish finite timeframes to validate and make those changes So if you have partners coming back in that say, hey, we think that this is wrong, you can politely say, thank you very much. We're happy to talk to you about this in 6 months. At this point in time, we're focusing on these other measures. We did not do this, and I wish that we had. We're constantly in conversations about various different performance measures about how this could be improved and yada, yada, yada. And it's dizzying. It's dizzying with 26 different measures. Other one is project into the future. Make sure that your terminology is going to remain fresh over time. An example is that our phase 1 measures were once called our existing measures, but we actually have many measures in existence now, and it's very confusing to the people that didn't live or that didn't start with CalOR in the very beginning. So keep in mind how your terminology is going to age over time, because you don't end up confusing people subsequently. Final 2, train with your end user in mind. There are a lot of things that I'll drop into the chat that have actually recently been developed, especially within the data infrastructure, that I wish that we had invested the time doing earlier and kind of missed the mark a little bit. And we would have been in a slightly different place, I think, had we done a little bit of training earlier on with the end user in mind. And then finally, greater emphasis on the end goals. This is just something that we get constantly about CalOR, like what's the purpose of CalOR? And you think that you've done a really good job articulating that. But as it would turn out, we actually spent so much time teaching people how to do the thing. We didn't actually spend enough time talking to them about why they were doing the thing and what they were looking to achieve by investing this time and energy. So I talked really fast. I hope I met the time frame. I'm happy to answer any other questions.
Shannon, thank you so much. And I feel bad rushing everybody. In fact, I was just talking to Casey Gray. What we're going to do is we're going to refashion the breakouts. So, and we'll get more into that. But I want right now just to turn over to our Hennepin County team here. We have Tina Dudzinski and Becca Golden. And they are both from Hennepin County. They are employment service coordinators with the MFIP program, the Minnesota Family Investment Program. So I know you're going to share a little bit more about how you've approached outcomes and how you've approached performance metrics. So
yeah, and Jeanette, how much time do you want us to keep it to?
You know, if you could keep it to about, let's see, we need to be breaking for breakouts around 3:05. So that's like, that's 12 minutes, 15 minutes.
Okay, thanks. Okay, great. Everyone can hear me okay? Thank you so much for having us here today to share our presentation regarding leveling up, resetting MFIP employment services performance metrics in Hennepin County. I think Jeanette did a great job on introductions already. I'm Tina Dudzinski with Hennepin County, and I'm joined here by my peer and fellow program coordinator, Becca Golden, for presenting. So if we can go to the next slide, please. So before we jump into the real meat of the presentation regarding our journey at Hennepin County and reimagining meaningful performance outcomes, thought it might behoove us to just share a little bit of information regarding Hennepin County and Minnesota program service delivery. So the Minnesota Family Investment Program is Minnesota's version of TANF. It is a state administered program by the Minnesota Department of Human Services, and it is county operated. There are 87 counties in Minnesota, and Hennepin County is the largest. So within Hennepin, we contract primarily the bulk of our employment services component to community organizations. Currently, we are funding 10 nonprofit organizations who provide the bulk of the services to around 13,000 participants per year. Each of these nonprofits, it's kind of scattered across Hennepin County. Many of these nonprofit organizations have multiple locations, which really helps us in terms of accessibility for residents across a really large county. We also have 3 other additional providers that offer parallel services in collaboration with our 10 contracted providers. These are generally program participants who are eligible for a state-funded track of the MFIP program. And this state-funded track is essentially targeted at serving participants with barriers that would prevent them from working at least 20 hours per week or more due to a condition that is expected to last 30 days or more. Next slide, please. So just a bit about contracting. So we contract with the nonprofit agencies. They're granted for 3 years, but they're renewed each year. And so because we are looking at these contracts each year, it allows us to have a little bit of wiggle room and a little freedom to make those small adjustments and tweaks due to our learnings and just adjustments that need to be made. But when it comes to philosophy shift, reimagining performance metrics as a whole, really big shifts in service delivery, those are generally more reasonable to be saved for the RFP process. So bringing us to 2021, when Hennepin County issued a RFP for EMPIP Employment Services, and this was an excellent opportunity to just really dive in and dig deep and redesign some of those key elements of program, which included really overhauling the performance metrics. At the county, we provide programmatic oversight, technical assistance. We offer a really robust annual program monitoring visit and training opportunities to both employment service providers, frontline staff, and leadership. Becca and I, so as mentioned, we have 10 contracted employment service providers, and Becca and I as coordinators are each assigned as a primary point of contact to one of those providers, so that they have somebody consistently that they're able to reach and request technical assistance and support from. Next slide, please. Okay, so let's touch on some of our program goals and the approach to our work before we talk about performance metrics. The reason for that is hopefully obvious, but I think as Shannon mentioned, the why is a big piece of how you design your performance measurement systems. So we really started there. When we did our 2021 RFP, we spent a lot of time on the goals that we wrote into it. Partially because there's a lot of kind of trickle down goals and things to focus on and all of that from the federal level down to state, and then at the actual county administered level. We can set our own priorities in a lot of ways as long as they nestle within the larger goals of the program and the funding. But so at the county level, these are kind of the top 3 goals that we identified in our RFP and are written into contracts. So the first one is going to be familiar to anyone who works in TANF, is just really emphasizing the importance of employment for stability for a household and exiting the program successfully. We list that first because we are nestling within our goals. I would say that these are not in any order of importance, however. Our second goal that we explicitly called out is building racial equity in education and employment rates among our participants. A reason for this is because not only is disparity reduction really a key focus for Hennepin County, but also in our program in particular, 75% of the residents that we served in our last program cycle from 2018 to 2020 were BIPOC individuals. And so the work that we were doing here is prime area in our county to be working on disparity reduction and increasing equity. The third goal was supporting long-term economic self-sufficiency of families to reduce the likelihood of returning to the program. So we focus a lot on longer-term success of individuals. With that comes this sort of approach to thinking about more transformational interactions with our residents and thinking about longer-term impact rather than immediate pieces of service delivery only. So really to support these goals, our service delivery model is something we also thought a lot about with our RFP and really are kind of backing up the program support piece of things to support these improved outcomes that we're searching for. So we're really focused on comprehensive case management, and we are very participant-led, person-centered in philosophy. So that's really kind of been a big shift for us in our county away from more of an output-driven mentality with this program. Next slide, please. Okay, so with our contracts ending, we actually extended them by 1 year because the pandemic was happening. We had started planning and then the pandemic hit, so we actually extended our contract cycle to make sure that we were at a place where the partners that we work with in our community were ready to take on kind of this new contract cycle with improved performance outcomes and different expectations and different policies and such. And so just generally, these are a couple of the things that we were trying to move away from, I guess. So some of the things that we wanted to improve upon. So this was not the first contract cycle where Hennepin was working on improving kind of our outcomes and being more outcome driven. In our previous contract cycle, we had added the self-support index, which is an outcome measure that is really longitudinal. It looks at where somebody is at 3 years after interacting with our program. So we incorporated that into contracts, but also we still had our county issued contracts focusing on the WPR as well. So we really kind of felt that there was a lot of dissonance out there with our providers that it's like, well, which is it? Which thing are we supposed to prioritize more? Is it immediate short-term things, even if that's not going to be best for the long term of this resident's family? So there was just kind of a rub there. And so that was something that we wanted to address definitely. Also, outcomes and outputs were really discussed interchangeably. So that's sort of the example of the TANF WPR and then this self-support index, which is much longer term. But it's a matter of making sure that we're careful about how we're saying this is kind of like Shannon said in her presentation. This is a process metric. This is how we're going to get to the outcome that is the actual point of our work. So trying to be really careful about that to make sure that priorities are a little bit more evident to our partners. Several of the indicators in our previous contract cycle, they were just a little bit vague, right? And so within some of these programs, when there's staff turnover, it's hard to know sometimes what a previous team, previous entities had put together. So then when you inherit a contract, it's kind of like, what was the thinking behind this target? Or, we didn't say how they're supposed to pull this number. Because our providers are the ones that do their own reporting. But so with that, we wanted to be sure that in our new contract cycle that we were really, really clear about defining what we want to see and how we track things, but then also be really careful about what we're setting as targets for contracts. And then the other thing was during the COVID kind of uproar, all of the chaos that put on our programs, performance measurement just really wasn't top of mind for anyone. We were in this place of adapting really quickly and meeting the needs of residents in a different way than the program usually wants us to. And so we just we didn't have the space or the bandwidth to focus on really excellent data quality or reporting or data analysis. So we wanted to really come back to that with this new contract cycle. Next slide, please. Okay, so some of our priorities, and I'll go a little bit faster. Looks like we're almost at 10 minutes here, but just generally, we try to do a lot of research out there, as you all are kind of, sounds like you're doing that too. We're still in that stage as well. It's hard to really take something maybe from a different state, a different paradigm, and directly copy paste, just can't work that way. So we took a lot of fragments and bits and pieces from different programs, different TANF programs, but also other programs, both kind of in our state and outside of it. But these were some of the priorities that we were thinking about too, is just really getting to the place where our performance metrics are better, are stronger, but they are also reasonable. So these were kind of some of the pieces that we were really focused on to make them feel very reasonable to our providers. Next slide, please. Okay, so I'm not going to talk about each of these, but of course you'll get them. This is just so you can kind of see how we have laid out our different performance metrics and what we actually landed on. So a couple of pieces with this that I'll point out. So these are our outcomes. The next couple slides have our outputs and inputs that are written into contracts. In some of these cases, we did include a target. So the self-support index, for example, that's the target that we get from our state for our county. And so 62% was not really a choice. That was so that we meet our state outcome on that collectively. For that second one there, that's a metric that we had in previous contracts. So we kind of knew what was reasonable within our network and what was possible for our providers to achieve. But as you see in the third there, some of these were new for us. And so we set this current year as a baseline year for us to gather actual data to see what might be a reasonable place for us to start when we set targets. So we're really using this year to collect some information, do data gathering, and then we will be setting targets for our next year's contracts. So I do have a description of some of this information. Of course, some of it's local and whatever, but you can take some time to look through that later. And actually, I will go through the next slide, please.
Hey, Becca, about 4 more minutes.
Okay, thanks. So with outputs, it's a similar thing. The one other thing I should point out here is a big priority for us with this program year is to disaggregate the metrics that we are tracking by race. We had some racial disparity metrics in our contracts before, but we didn't really kind of go that deep into them. So we're trying to really reset there so that we know what disparities exist before we try to address them. But so each of these different indicators that have an asterisk in the subject line, those are the ones that we are going to actually breaking down by race to see how is this program impacting different residents differently. Okay, and then you can advance the next slide. Again, for your future information, this is some inputs that we're asking providers to continue investing into our program for continuous improvement. And then next slide, and I will hand it back to Tina. It's a race against time.
Yeah.
Okay. Let's talk a little bit about implementation and what it has been like for us with all of these new performance metrics for our network. So I'll go through this really quickly. First of all, we've just had to be really honest about leaning into the fact that making meaningful changes takes time. The learning curve is real, and at times that learning curve can feel very, very steep. We have heard resounding from our network that where do we start with meeting all these performance metrics? We know we're not where we want to be, and we've got lots of work to do. So where do our priorities lie? So we've developed tools such as what we're calling the Employment Service Provider Dashboard. Really what this is a snapshot, a real quick look at the network as a whole's progress towards key components and case management. That we know if you can do these fundamental and foundational things in case management, that they ultimately support positive outcomes. So many of these things really center on timely and proactive ongoing engagement. To support this, we've also detailed or developed some really detailed reporting guides. So acknowledging that those pulling data within our network, the skill sets vary, right? Some are very familiar with the reporting features within our electronic case management system, and others are not. Some are really comfortable exporting and manipulating data in Excel, and others are not. So we really needed to provide them with the support needed to pull consistent data and get accurate results. So spent a lot of painstaking time really creating step-by-step guides for folks to be able to follow that. We've hosted one-on-one technical assistance sessions and even pull data alongside our contracted providers to see that we're getting the same numbers so that they feel confident moving forward. We are working with our partners at the Minnesota Department of Employment and Economic Development to help support us in developing a report that allows us to disaggregate race easier. So we know all of that information lives within the system. It is a much heavier lift to manipulate the data than we thought that it would be, and it's a very big ask for our providers. And so the Minnesota DEED has been very gracious and are willing to work with us on really putting together that data in a more easy to access format. And so we're just pending that to be released. And then also we are just really emphasizing to our provider network that they're really just take advantage of this baseline year. Get comfortable reporting accurate data, even if it's ugly, even if it's not meeting the performance metric, even if it's not where you'd like to see your staff performing. It's really critical for us to receive accurate data in the baseline year so we can set reasonable targets in coming years. Next slide, please. Next steps. So we know that we're going to have to update reporting guides when we have information regarding how to disaggregate data. We're going to need to provide training to staff who are going to be completing those reports on our behalf. We know we're going to have some retroactive work to go back in time and retrieve disaggregated race data for our full network. We will put together an annual report regarding what we've learned, evaluate the data as a whole, and set some reasonable targets. And as Becca mentioned, lastly here, just continuing to build really clear resources and policies. So one of the big hiccups and barriers that Becca and our program manager, Carrie, really bumped up against when they were writing the RFP was there wasn't a lot of historical data regarding, why a particular team arrived at the decisions that they did regarding performance metrics and how to pull that information. And so we really want to be able to build resources that can kind of weather turnover, that can survive us as we have transitioned out of the role and can really provide a clear path as to where we were going at that point in time. I think next slide. There we go.
Well, I want to thank everyone. I